Today we will be starting our first lecture for anatomy. In this lecture, we will be discussing few points which are very important for the exam. When you are dealing with any MCQs, so first of all, it is not that you have to mug up all the questions from Dental Pulse or any MCQ book, because the paper which is being set will be never from the book. Since many years, they have a tendency of preparing exam paper from the previous year papers. Now, they will not ask you the repeated questions which are asked in every exam. They will just go with your content. Now, what is content? Content is a thing that means you should be knowing the base of the anatomy or base of any subject. In case if you forget the base or any content, you will be confused with the upcoming MCQs. Now, what is the difference between content and what is the difference between knowledge? Knowledge means, suppose if I ask you who is the Prime Minister of India, you will answer he is respected Sir Narendra Modi. Now, what is the base? Base is that if in the previous year exam, the question is who is the Prime Minister, you have to understand that questions might be asked who was the first Prime Minister, enumerate all the Prime Ministers in their ascending order of their choice, chronological orders. So same way in anatomy, if the question is asked for carotid artery, you might be surprised that it might be asked for the vein in the next exams. It might be asked for the lymphatic vessels. Now all these correlations you have to prepare in your notes. Before approaching any exam, you must first of all clear your goal. What to study in a day, how much to study, and how to prepare notes so that you can revise easily in the upcoming lectures. Now in today's lecture, we will be discussing about anatomy preparation. How will you prepare anatomy and what notes you have to make. So on the screen, you can see we'll be discussing overview of the cardiovascular system. Okay, so now in the exam right now, this is a book of foreign exams, NBD, IND, etc. So what they will do is they will ask you to label. For example, if this is image based question, they will ask you to label what is this A, what is this B, what is this C, what is this F. So you have to go with this marking first or labeling first. In this way you will understand all your anatomy portion. Okay, now first of all, see here it is. A is internal jugular vein, B is common carotid artery, C is superior vena cava. So you can see this is superior vena cava, this is carotid, and first one is vein. So now you have to label this and you have to understand this. In this way you have to recall. Now these are the ready-made diagrams. What you will do in your notes or in your preparation, you will directly mark or directly draw the diagrams, then go for labeling. In the first time you have to draw a diagram and then you can label it. Now in the upcoming exams, paper will be tough. They will ask you what is this, what is this in the image based questions. So here in this diagram you can see that all the labelings are given below answer. For example, if you want to go for D, it will be brachial artery. This is the main artery for hand. Okay, and for E, it is inferior vena cava. This is inferior vena cava, this is superior vena cava, and this is mainly the center of the body or heart. Okay, so now you have to understand this concept, what that you have to always prepare content when you are preparing for multiple choice questions. Why? Because in Pulse they have given some questions and answer will be there, but for your upcoming exams, if you want to prepare NEET MDS, dental GPSC, your content should be clear. Okay, which are the arteries of the face, which is the longest artery, which is the longest nerve, smallest nerve, first or largest nerve, or the nerve for the hyperacusis. All the answers will be given if you prepare your content properly. Okay, now regarding circulation, how do they circulate, or how the heart manages the circulation? Okay, you can see the heart is here, and the black arrows, when you see the black arrows, it indicates that from the heart, deoxygenated blood or the poor blood, oxygen poor blood, is transferred to the lungs. Now for your understanding, whatever blood in the heart it comes through vena cava, it will be deoxygenated or poor, or in which tissue has absorbed energy or gained energy, and the blood has hemoglobin which is of energyless or no energy. So here from the heart it will be transported to lungs. In the lungs, oxygen will be transferred via the capillaries in the lungs alveoli, and then oxygenated blood will be entering. You can see here from the lungs, oxygenated blood will be entering here, and then this blood will be transmitted to the body. Once this blood is used, or these good things are used for energy production, then the deoxygenated blood is returned to the lungs via superior vena cava, and then it is gone to the lungs. So it is cardiopulmonary circulation. Basically, it is mainly for the transfer of oxygen only. CO2 and oxygen. CO2 will be in this black arrow, and in this white arrow there will be oxygen transfer. Okay. Now question from these things, two arteries, basically arteries carry oxygenated blood, but two arteries carry deoxygenated blood. Okay, so which are those? One is pulmonary artery and second is umbilical artery. Okay, so you have to remember these things. And two veins carry oxygenated blood. Which are those? Pulmonary and umbilical veins. These are the exceptions where arteries carry deoxygenated blood. Now our blood, so you should know about blood. What does it contain? Plasma and all the cells. Okay. Then erythrocytes will be there, RBC. Hemoglobin will be there. Leukocytes will be there, or WBC will be there. Then eosinophils will be there. Basophils will be there. Lymphocytes will be there, basically responsible for immunity. So here what they are doing, for example, they will ask you in exam that label this, which is this, granular or agranular. Then in case of A, it is erythrocyte. So you have to mark all these things. This is erythrocyte. Okay. B is thrombocyte. So this is the shape of thrombocyte. Okay. Now anterior surface view of the heart. What is this? You have to draw the diagram of the heart. In the morning lecture, I already explained that first of all, your diagram should be clear, your labeling should be clear. So what is A, what is B, what is C, all these things you have to label, and then you have to recall what was the labeling. Okay. Now in case of posterior surface of heart also, you have to go for proper labeling. Why? Because MCQs can be solved from this. J is inferior to K, or K is inferior to S. You will be asked to assign its proximity. Now in cross section of the heart, you can see this ventricles will be there, auricles will be there, valves will be there. Okay, so in this diagram you will be able to locate all these labelings. Now superior aspect of the heart. Okay, from the superior portion you can see this, that there will be valves present. B and A both are the valve, tricuspid as well as bicuspid valve. Okay, now vessels overview. For example, if a blood vessel is transmitting from the heart, so you can see that there will be arteries, there will be veins, there will be lymph vessels, all will be there. But which vessels have what properties, that you should recall. Questions also will be asked that label the muscles present in the walls of these blood vessels. So our vessels, different vessels have different overview. Okay, so this is the overview of veins. They have valves in them. Okay, basically all the veins which are below the level of heart, they have valves, and above the level of heart they don't have valves. Okay, so you have to remember this point. Veins above the level of heart do not have valves, because through gravity only the deoxygenated blood will be coming to the heart. Okay, now the different levels of these vessels. First of all, you understand that the I is for smooth muscle. Okay, here A is artery, A is vein, and B is artery. Okay, so artery you can see that it is thick, and vein it is thin. Vein cross section is here and artery's cross section is here. In artery we have more layers. For example, tunica externa, okay, tunica media, and then tunica intima. Okay, these are the layers of arteries. In case of veins, we have only few these layers. Okay, then tunica interna is basically folded into walls. The inner layer is absent. So how you can create MCQ from this? That blank layer is absent from veins, or it not present in veins. The answer will be tunica interna, and for this reason veins are thinner as compared to arteries. So during your dissection also you will see that the arteries are thick as compared to veins. Now capillaries, they are both different from arteries and veins. Why? Because they are only composed of endothelium, only endothelium. Capillaries contain only endothelium, no tunica externa, no tunica media. In this way, you can understand its flexibility. It will be very soft and flexible or fragile in the nature. Now see, as I mentioned in today's lecture, this is overall arteries which supply in the body. From the heart, you can see that first of all there will be ascending aorta, aortic arch, then thoracic aorta, abdominal aorta. All these things you have to label here. Okay, here there is brachial artery. Okay, so all these arteries you should know. This will be internal carotid artery, and there will be bifurcation of the carotid artery. Common carotid artery will be this, then there will be bifurcation of external and internal carotid artery. So in this way you have to understand. So when you are preparing notes, you also have to understand this bifurcation. It will be at C4 level, vertebrae C4 level. So you have to mark this. In your exam, question will be asked, the bifurcation of carotid artery is at which level? C4, C5, C1, etc. So all these things you have to correlate. Whenever you are reading any book or any topic, you have to understand. For example, thyroid gland. Okay, question is asked, thyroid gland is located at which level? The answer is C5 to T1. Okay, cervical fifth to thoracic first vertebrae, thyroid gland is located. So in this way you have to clear your MCQs, because this is the most common MCQ asked. Thyroid gland is located at which point? Bifurcation of common carotid artery is at which point? All these points are important. Hyoid bone is located at which point, etc. In our first year anatomy also, when we were discussing this when we were reading this BOWEN'S book, we used to give the location at this level. This is the anatomical object or anatomical position of this object. All these things you have to label: common carotid, brachiocephalic, ascending. This book I will send you, and when you will read this book, you will understand that all these labelings are very important. So when you go for the first time, you just read and understand, and then without looking, you have to label all these things. So it's a sort of homework also, and it's a sort of puzzle also. Okay. Now, head and aortic arteries. Now, as I explained, from the common carotid artery, okay, here there will be common carotid artery, and there will be bifurcation here and here. Okay. Now, common carotid artery will be divided into external and internal carotid artery. Okay. And common carotid artery is from brachiocephalic artery. Okay, from the brachiocephalic artery we have common carotid artery. Okay, first of all, brachiocephalic artery. From that we have a branch of common carotid artery, and from that we have external and internal. Okay, in this way you have to remember all these levels. So you have to do these diagrams, and you have to understand this. This is the level, this is the bifurcation level, this is the lingual artery, this is the internal carotid artery, this is the occipital artery. All these things you have to label, and then you can understand this anatomy. Nowadays, what happens in the exam? They will ask you this question that mention or answer this: what is the labeling of artery number B? Okay. Same way, in the frontal view, you have to answer all this. Here K is for common carotid. You can see this is common carotid. Okay. Here they will be at this level, it will be bifurcating. This is internal carotid and this is external carotid. Okay. Here D is vertebral artery. See, you can see here D is vertebral artery and K is common carotid. Once again, this is common carotid artery. Then common carotid artery is from F, that is from this. This is brachiocephalic. Okay. So in this way, you have to understand the anatomy, and before reading anything, you have to draw these diagrams and clear all these labelings. Then you will be able to understand. Now, arteries in the brain. You can see there are many arteries. Occipital arteries will be there, then circle of Willis will be there. This is important. Here they will form a circle of Willis. So you have to label all these arteries. Which artery is anterior to other, which artery is posterior to other, which is superior to other. All these things will be easy when you go with this labeling. Okay. Now upper limb arteries, these are not important for us. We will skip this point. Now head and neck veins. What about the veins? The same way what we discussed for arteries, you have to understand. All these veins will start from the head and neck and they will carry deoxygenated blood to the heart. Veins above the level of heart do not have walls. Okay, so they will drain all this from here, and then through here they will transmit via superior vena cava to heart. So all these labelings also you have to make clear. Okay. Lymphatic system, this is also important. Lymph is basically considered for immunity and basically for our cardiovascular system. It's the interstitial fluid, that is the lymph, the tissue. Between the tissues we find some fluid. Okay, the main role of this lymph vessels is to drain the interstitial fluid. Okay, now fluid called lymphs, it passes through lymph nodes. Okay, and in the lymph nodes you find that impurities and foreign microbes are removed. Then this lymph also contains, or the lymphatic system is also containing spleen as the organ, is basically protects. What is the main role for lymphatic system? It protects us from foreign body. Okay, through lymph nodes the foreign bodies are removed and our body is eradicated from the foreign body. Okay, in the same way spleen has a role of removing old RBC. So therefore MCQ can be generated. Blank is the graveyard of RBC, or blank is the last end place of RBC. That answer is spleen. Now what happens in spleen is capillaries, they are very narrow. Okay, capillaries are narrow. So when the capillaries are narrow, you find that blood vessels are somewhat larger. So when they travel through these, the blood vessels or RBC will be dying because of the narrowing of the capillaries. They cannot pass through these narrowed capillaries. So in this way, we find that spleen is the graveyard of RBCs. Okay. So this is the lymphatic system. We have many lymph nodes. We generally palpate submandibular lymph node in case of abscess in the mouth. These are the lymphatic drainage. You can see this is submandibular lymph node. All these nodes will be involved during cancer or metastasis. Now, our tonsils. Questions can be asked. See, most important question will be nerve supply to tonsil. Okay, so here in this diagram, we can understand that tonsils are labeled. Then what are the other parts, and all its blood vessel as well as capillaries, veins, lymphatic as well as nerve supply will be discussed. Okay, the pharyngeal tonsils are located in the nasopharynx. Okay, they provide protection from the inhaled material. What is the role for palatine tonsil? They are responsible for immunity. Whatever you inhale, it will be filtered through the tonsils. Okay, then tonsils also form a Valder's lymphatic ring. Here there will be a layer of tonsils lymph node which forms Valder's ring. Okay, now from the front view you can see this, that this is uvula. Okay, and pharyngeal tonsil is behind this and palatine tonsil is here. Okay, this is a ring will be formed. Okay, this will be a ring of tonsil, Valder's lymphatic ring, pharyngeal as well as tonsillar ring, palatine. Now spleen. So see, when you find that spleen is labeled here, you see 9th rib and 10th rib. So in your exam, question might be asked. Spleen is located at the level of which rib? So you'll be confused what to write. So in this way, you can remember that in the spleen, the level is of 9th and 10th rib. Okay. Kidney is below that. Pancreas is also below that. Now, two types of immunity. This is a question for physiology also, active as well as passive. Okay. What is active? The active immunity is, it is already present in the body. It is from the birth only. And what is passive? Passive is immunity which is being generated by inducing vaccine. Okay, whenever a vaccine is given, you will be creating antibodies in the body to prevent that antigen. This is called passive immunity. Now, overview of the respiratory system. Okay, you know that there will be nose, nasal cavity, pharynx, larynx. All these diagrams you have to label. Now, this is important now. You have to label that where is the trachea, where is the thyroid gland, what is the level of tracheal rings, what is the level of this bifurcation of trachea, and you have to label these lungs. Regarding nose and nasal septum also, you have to understand all these cartilages. So when I will be giving you this book, you have to first of all go through all the diagrams and first of all learn all these labelings. This will clear your 50% of the anatomy. Okay, why? Because in this diagram there are many important things which will be asked in the exam. You can be asked that what is crista galli, what is the continuation of crista galli, etc. Okay, nasopharynx will be asked. All these labelings will be asked. Hiatus semilunaris will be asked. In the hiatus semilunaris, we have the duct opening of what? All these things will be asked in your exam. Now, nasal concha, inferior, superior, and middle nasal concha also are will be, you have to label and remember them. Okay. Now, nasal cavity lining, it is respiratory epithelium, which is basically pseudostratified ciliated columnar epithelium with goblet cells. So this is important, most important MCQ for your exam. You will be asked which of the cell is present in respiratory epithelium. You have to answer that it is goblet cells. Which type of epithelium? Pseudostratified PS, pseudostratified ciliated columnar. This type of epithelium will be present in the nasal or respiratory epithelium. Okay. So basically, whenever you find that there are goblet cells, so in your notes, you have to label that goblet cells are mainly found in respiratory epithelium. All these things you have to label. What is the level of this artery, thyroid gland, cartilage, trachea, ring, first ring, second ring, all these things. Pleura of the lungs. A is parietal pleura, B is visceral pleura, D is middle lobe, G is pleural cavity, F is cardiac notch. This type of image based questions can also be asked. If you are having any doubt, you can comment. Otherwise, this book is very easy. You can go through this in 1 or 2 days and finish the anatomy. After all these diagrams are clear, it will be very easy for you to answer the MCQ. Okay. Now, salivary glands, parotid, submandibular, and sublingual. Okay, this is parotid below the ear. This is submandibular, and sublingual. Now about the tooth. We already know about the tooth. Esophagus also, we can see this. There will be esophagus sphincter where the stomach will be connected. Okay. Here there will be sphincter. When bolus is in the esophagus, when it is traveling to the stomach, the sphincter opens, and as soon as the food passes to the stomach, the sphincter or valve closes. Okay. So I think today's lecture is enough. You have to go through this book and understand all the labelings, what type of epithelium is present in the intestine, what type of epithelium is present in the oral mucosa. All these things you have to understand. Go through the diagrams of this liver, spleen, etc. Levels also you have to check. Hepatic artery also, it carries oxygenated blood to liver. So go through this book, and then we will be discussing after 2 or 3 days the MCQs and further anatomy portion. Okay. Right now for today it is enough, and we will be joining for this lecture after 2 or 3 days. Till that time, if you are having any doubt, you can call me or you can WhatsApp me. Okay. Here the unit of nephron. What is nephron? What is contained in the BOWEN'S capsule? All will be this discussed in this diagram as well as labeling. Okay. You go through this, and if you are having any difficulty, please message me. We'll be discussing in the next lecture few MCQs. Okay. So it's time for telling you bye bye. Have a nice time. Good night. Bye bye.